This is a human rights issue, no doubt about that. So one would think the EFF are within their rights to lay criminal charges. What are they saying?
Well, a very good afternoon to you, Natasha. The EFF has emerged from the Gauteng Central Police Station, the Johannesburg Central Police Station rather, where they have been interacting with officials here on exactly what scope they can act within the law to make sure that they hold Qedani Mahlangu accountable by default, also in terms of the charges that can be laid linked to service providers as well, who are also part, according to the EFF, of this whole saga, who are also have questions to answer to and who also should bear responsibility. Let's get more from Mandisa Mashiko. She's the EFF Gauteng Legislature Caucus leader. Mandisa, can you just let us know exactly what is the scope of discussions in terms of laying the charges, and what charges are you expecting or have been laid here?
We've laid a charge of murder, and the persons that are responsible for the murder include the Premier of the province, as well as the former MEC Qedani Mahlangu, as well as her HOD and other officials in her department that are complicit, as well as obviously those NGOs of the total 27 NGOs that are fingered in the Ombudsman's report, and of course any other parties such as transport service providers who are responsible for moving the patients from Life Estimeni to the various NGO locations.
So this is the entire sector, if I can call it, that you feel should be held accountable for the 90 plus lives lost?
It's extremely important to widen the scope of persons responsible as much as possible so that you ensure full accountability, because the loss of lives, nothing can be done about that. The people cannot be brought back to their families and their loved ones and their neighbors and communities. And so anyone who has been partly responsible in leading to these deaths must be held responsible, the law must kick in. And on a very serious note, we can't continuously see situations where our people are killed and murdered by the very government that is fed by the people's taxes, and simply nothing happens, and only a handful of people or one or two individuals are fingered as some kind of scapegoat. We can't allow that. Accountability is accountability, and people must learn to take responsibility.
And finally, what's the way forward? We seem to have a health a system that has been shown to be in some crisis or in some deep trouble. Of course, Health Minister Aaron Motsoaledi has also unveiled his national health plan, which would revive it. What do you think needs to happen to ensure that this type of thing doesn't happen again?
Part of the core principles of a functional and successful national health insurance scheme is that there must be governance. Governance must be upheld. There must be properly trained people. There must be respect for processes of regulation and the law. In this example, where we lost 94 people in this province, governance has been completely ignored. We have been misled and lied to by Qedani Mahlangu, who repeatedly refused to heed calls by the EFF MPL serving on the Health Committee, Tina Mabala, as well as some other MPLs from the DA caucus, who strictly asked her to halt the shutting down process of the Life Estimeni clinic, because we already had information and we knew for a fact that the government and the department was not ready to effect those transfers because there were no suitable places to take them to. So essentially what we're saying is that we must call for greater professionalization of the health sector, greater accountability even of officials and staff members working in the various clinics and hospitals. And our communities and society in general must be mobilized and agitated enough to demand that level of accountability. It's not acceptable that we keep getting told about beds that are not there, that there's not enough nurses, when the training colleges have been there, when all government needs to do is just determine how much training needs there are and train the requisite number of people. For Pete's sake, we are sitting with unemployment close to 50% in this province amongst the youth. So there's no excuse. Training must happen, and delivery of services at clinics and hospitals must happen up to standard, and we will demand that as the EFF.
Thank you very much. That was the EFF's Mandisa Mashiko, just outlining exactly what the party's position and reaction is to this whole developing story. As you know, the EFF earlier coming to the Johannesburg Central Police Station to lay charges against Qedani Mahlangu, and they're saying that it is a broader investigation to be held in terms of service providers for the Gauteng Health Department at large. With that, it's back to you in the studio.
Tumole, thank you very much. Tumole Mahlangu, live there from Johannesburg.